Okay, good afternoon, and thank you everyone for joining us for our Career Connections webinar. My name is Brent Giangregorio, and I will be your host today. We are very excited to partner with Sarasota Memorial Hospital for today's webinar on hospital jobs and careers. Before we get started, though, just a few housekeeping items. Today's session is being recorded and will be available on our YouTube channel within 48 hours. As well, we'll send a link to the recording along with the presentations to everyone who registered for today's session. Because this is a webinar, all of your lines are automatically muted. But you can ask questions using the QA box at the bottom of your screen. As we move through the presentation, feel free to type your questions in the QA box, and we'll leave about 10 minutes at the end of the webinar for questions. Okay, so today we have a great lineup of speakers. We're going to hear from Corey Tile, a Senior Talent Acquisition Advisor at Sarasota Memorial Hospital, the Venice campus. We'll also hear from Hannah Miller, Talent Acquisition Advisor 2 at Sarasota Memorial Hospital, the Sarasota campus. And then we're also going to get a testimonial from Lauren Pellicott, a multi-skilled technician at Sarasota Memorial Hospital. Then we'll move to Q&A. After the Q&A, if everyone could stay on for 1 extra minute for a survey, that will pop up on your screen. We would really appreciate it. Your feedback is really important as we use these surveys to help us with future webinars and programming. Now, before I turn this over to our presenters, I just want to take a few minutes and tell you a little bit about the Women's Resource Center. The Women's Resource Center has been empowering women in Sarasota and Manatee County since 1979. Currently, we have 3 locations across both counties, one in Bradenton, one in Sarasota, and another down in Venice. We serve over 1,700 clients a year and deliver over 5,000 hours of programming. Our goal at the Women's Resource Center is to engage, educate, enrich, and empower women of all generations. And we're a place women can call when they're not quite sure where to turn to for help. To do that, we offer our clients resource advising, mental health counseling, we have career services, we have educational workshops and programs, as well as scholarships, as well as legal and financial consultation and education programs. All of this is offered at a low or no cost to our clients. Since this webinar is about careers, I'll talk a little bit more about our career services. So our career coaching program offers individual assistance in preparing for a successful job search. So that can include career discovery, skills assessments, resume preparation, interviewing skills, networking techniques, and much, much more. Additionally, we have career centers where clients can come in and conduct online job searches, work on applications, update their resumes. We also offer one-on-one computer tutoring to help clients navigate online job sites, help them upload resumes. They can get help with the computer basics as well as Microsoft Office applications. Additionally, we have 2 career closets, one in Bradenton and one in Sarasota, where we have free clothing and accessories for women who are attending job interviews or have just secured a job and need work attire. Okay, so again, we really want to hear from you. So if you do have questions, please use the Q&A box at the bottom of the screen. And again, we'll get to the questions at the end of the webinar. Just as a reminder, this webinar is being recorded, so you can watch the replay in case you missed any information. We'll send this replay in an email in 24 to 48 hours to everyone that registered, and we'll include any flyers, presentations, and other materials from the presenters as well. And as I mentioned, when the webinar ends, you'll see a survey on your screen. We ask that you please complete the survey so we can understand how we can improve. Thanks so much for attending today. And for that, I'm going to turn it over to our presenters at Sarasota Memorial Hospital.
Hi, so Brent, how do we share the presentation with everyone?
Do you see the share button at the bottom?
Hold on just a second.
Okay.
Yep, share screen. Okay.
There you go.
And that's exactly perfect. So we should be able to share that presentation. Can you guys see it okay?
Yep, perfect.
Wonderful. All right.
Well, thank you so much. I'm Corey Tile from the Venice campus.
And I'm Hannah Miller. I'm a talent acquisition advisor on our Sarasota Hospital campus.
And we want to welcome you today to this seminar as you learn more about various job opportunities available through Sarasota Memorial Healthcare System.
So these three circles that you see on your screen, right? So passion, skill, and opportunity. Our goal for our open positions and for kind of engaging with you all today is to help you find a position that is going to be somewhere in the middle of all three of those, right? So it's going to be a combination of what you love to do, what you're good at, and open positions at SMH, right? We would love to have you get started with us, and we want to find a position that is going to be the right fit for you, where you're going to be able to grow and to flourish and to expand your career, and hopefully in the healthcare setting.
So Sarasota Memorial Hospital has been here since 1925. We are a community hospital, not-for-profit hospital. So we truly put our patients first. We started with just 10 employees and 32 beds almost 100 years ago. And now today we have over 9,000 employees. We are the largest employer in Sarasota County. You'll see pictured two of our hospitals. The main campus in Sarasota is an 839 bed facility. We've recently opened the Jellison Cancer Center that are 56 private suites for top-notch cancer service. And then we opened our Venice Hospital a little over a year ago. It's a 110 bed facility. We are in the process of expansion right now. We'll be at 300 beds here shortly. We also have freestanding emergency rooms, first physicians group, doctors' offices, as well as urgent care facilities.
So we have positions that are both clinical in nature and non-clinical. So a lot of people hear, oh, work at a hospital, and they think I have to be a doctor or a nurse in order to work at a hospital. However, that is so not the case. We have a ton of clinical opportunities available and a lot of non-clinical as well. So some of our non-clinical positions, they're the housekeeping positions with environmental services. We have patient transporter positions, patient registration positions, sterile processing, and food and nutrition. We also have some clinical positions or a clinical position that doesn't have requirement for any type of background in healthcare as a patient safety attendant. So we'll talk a little bit about all of these different positions, but obviously we also have registered nurse positions, LPN positions, patient care technician and multi-skilled technicians. Those are more CNA type roles, certified surgical technologists and operating room technician positions as well. So those are all on the clinical side.
So I'd like to talk to you a little bit about environmental services. This is such an important role here at the hospital. These are the folks that help keep our facility clean. They're going into patient rooms and disinfecting those rooms. You think about a family member going into the hospital, you want to make sure that there's nothing left over from the patient before. So that room is completely disinfected and make sure that it's safe for your loved one to be there. So our environmental aides are changing bed sheets, cleaning the bathrooms, mopping the floors. They're engaging with the patients and wishing them a great day and making sure that they have a really nice environment to work in. Those positions start at $16.50 an hour. One wonderful thing about working at the hospital is that we offer shift differential and weekend differentials. So you make more if you work in the evening, you make more when you work on the weekends. So this slide showed you a little bit more about our career ladders, and truly and honestly, we have career ladders in every single position that we offer. So you're not going to come in and work in a job, and if you want to move, you're not going to have any difficulty moving up. Some people they love housekeeping and they've done it for 25 years. And that's the job they want to stay in. And that's just fine with us if that's the job you love. But if you have a hunger to grow and learn more and move up in your career, we have a career ladder for each and every position. So you'll see the environmental aide, that position is listed. There's an environmental technician where we'll teach you how to utilize the floor machines. You can move into a liaison role where you're checking in with patients to make sure their rooms are tidy. You can move into a supervisory role or a manager role, and you see how the income goes up as you're moving into those various roles. Now, one of the things I'd like to mention is that the environmental aide or technician doesn't require a high school diploma or a GED. Many of the roles that you'd move into do require that. So we always encourage you, get your foot in the door now, even if you don't have that education, and we can help you get going back to school. Food and nutrition, we have wonderful restaurants here at the hospital and little kiosks as well. And so there's all types of positions that you would imagine in a restaurant. There are food service workers that are helping to cut the food, dice the food, get the salad bars ready. There are dishwashers, people that are behind the scenes. Nutrition attendants, those are the folks that go up onto the floors, take the patient orders, bring those orders down to the kitchen and then deliver the meals. A nutrition technician, that's a person who understands more about the patient's diet, making sure that we're providing the right type of diet for the patient's illness. And cooks. So we have all different types of positions available within the kitchen. This is something that shows you a little bit more about the career ladder available in food and nutrition as well. And you can see how those salaries go up and the various positions that you move into. I know one of the positions that we have available right now in Venice is a retail attendant. That's a customer service type position. So you don't have to have food service experience, just need to have some good customer service background. So there's all types of different positions available within that food service area.
I'm going to talk a little bit about the patient transporter position. So Lauren, actually, she's here with us. She's currently a multi-skilled technician in the hospital, but she actually got her start with SMH as a patient transporter. So our patient transporters are assisting patients getting from one place in the hospital to another. If they're going for a procedure, for a test, or if they're even leaving the hospital, patient transporters are kind of that go-between to help those patients get from point A to point B where they need to go. Starting pay for this position is $16.50 an hour. And again, as Corey mentioned earlier, there are shift differentials available for all of our open positions for working afternoon, evening shift, night shift, and weekends. Patient transporters are a great kind of place to get a start in the hospital just because you get to see a lot of different units. You're traveling across the hospital, so you're learning the layout of the hospital very well because you're responsible for getting patients from point A to point B, and you're getting to see how the different units work. So it's a really great place if you want to kind of get a feel for the different areas of the hospital, and just kind of get a good fit to see what might be a good place for you to land once you have promoted into a different position. Now, the patient transporter position doesn't require a high school diploma or GED. As Corey mentioned earlier, there are several positions at the hospital that do not have that requirement. So as long as you're 18 years of age and able to work, then we would love to talk to you about these positions specifically.
Sterile processing. Sterile processing is another great place to get your foot in the door in the hospital and learn a new skill. So these are the folks that help us with processing all of the equipment that we use in surgeries. So you can imagine that there's about a 10-step process of making sure that they're clean, they're decontaminated, they're sanitized, they're ready. And there's a lot of training that goes on, and we provide a lot of hands-on training for that. So the Sterile Processing Assistant here in Sarasota does not require any experience. In Venice right now, because we have a smaller team, we do need some experience. But in Sarasota, they have openings that do not require any experience. It does start at $18 an hour, so it's a great entry-level position. And then they work on getting you through a certification process. So you may see, if you look at a job description for Sarasota Memorial, something that will say maybe they need a BLS, a basic life support, within 60 days. When that says that, we provide that for you. If it's something that's required upon hire, and that's something that we'd ask that you get on your own. But if it's saying within 60 days or within the first year, we provide that for you. We provide the training, we pay for that. So you'll see under the instrument tech, for instance, that it says you need a certification as an CSPDT or CRCST. Those are certifications that we would help you get so that you can keep moving on. Something that I want to mention that's not on the slide is there is a great need in our community for certified surgical techs. So that's something, if you've ever watched a medical show, when they're in surgery, they're handing them the various surgical pieces, instruments, and it's usually about a 1 year to 2 year program. There's a great need in our community for that. So if it's something that you think that you may be interested in, a sterile processing position may be a great foot in the door, and then you go back to school and we can support you in that endeavor.
So I'm going to talk a little bit more about our clinical and nursing positions. I specifically recruit for all of these positions on the Sarasota campus. All of these have their basis in nursing, right? So the patient safety attendant position is that entry-level position where the position doesn't require a high school diploma or a GED. It starts at $16.50 an hour. The patient safety attendant, like patient transporter, is a great place to get your foot in the door at the hospital. We only hire in this position currently in per diem, which means there's no benefits available with employment. However, those managers will promote you to either part-time or full-time as they have openings available. Typically for the first 90 days or so, you would start out as per diem in this role. Now, you would be providing patient care at the most basic entry level. You would be monitoring a patient, and you would be assigned a patient per your shift that is a high-risk patient, right? So in need of constant supervision, and then coordinating the care with the nurses that are on duty at that time. So you're responsible to make sure that they are taken care of during your shift. This position also, like patient transporter, allows you to see different units in the hospital because you would be assigned a different patient on a different unit, and it would really be dependent upon where the need is in the hospital where you would be assigned. So you'd get to work in different units, get to see different units, kind of see what the best feel or which units you feel like might be the best fit for you once you do promote and get a permanent position on that specific unit. Some other positions that are on this slide are the patient care technician and multi-skilled technician position. These are CNA type roles where you are, again, doing basic patient care, helping to meet those daily needs of the patients, making sure that, that they're cleaned up, that they are, that their needs are being taken care of, that if they are in need of being rotated or moved, if they're in need of, kind of walking down the hallway, it's that basic patient care for the CNA type roles. Now, you do need to have a CNA license or be enrolled in nursing school and have completed your first semester of clinicals in order to be eligible for these positions. The licensed practical nurse position is similar. You do have to hold an LPN license in the state of Florida in order to be eligible for these positions. And again, that position has more in-depth patient care that's required. Same thing with registered nurse. All of our registered nurse positions, you do have to have a Florida registered nurse license. You can get started with either an Associate's of Science in Nursing or a Bachelor's in Science in Nursing. However, the requirement for our open RN positions is once you're hired on, you do need to obtain your Bachelor's of Science in Nursing within the 5-year period of your start date. This slide shows that career ladder for nursing, right? So you can see the pay range goes from $16.50 at entry level up to I think it's $31.50 for registered nurse right now. We've recently had a pay increase across the board at the hospital, so our rates are really competitive. And we also, when you look at starting pay, the starting pay is based on no experience. So we do credit for experience. If you come in with additional experience from another employer or another opportunity, we do credit that experience. This does kind of show what I discussed on that previous slide about what educational background is required for each of these positions. And we do have flexible schedules available for all of these positions as well. So you can work full-time, part-time, or per diem in any of these positions. I'd love to share with you a little bit about this awesome program that we have available to our SMH employees. So this is a program that I have the pleasure of getting to see it in action. We have a 6-week paid training program for our employees to upskill So they are able to go to Suncoast Technical College free of charge for their CNA license. We have a grant from Career Edge, which is affiliated with Sarasota Chamber of Commerce, that pays for the tuition, fees, books, uniform costs, and licensing exam costs for our employees to go through the training at Suncoast Technical College. It's a 6-week training, 24 hours a week. And during that time period, SMH covers your wages, our employees' wages for that training. So these employees, not only is their training paid for by this grant through Career Edge, but also their wages are covered during that time period. So they're not having to still work 40 hours a week or 36 hours a week while they're in school. They're in school 24 hours a week, and then the remainder of their requirement, they're scheduled over the weekends. So classes are held Monday through Thursday. They are then able to pick up shifts Friday, Saturday, and Sunday. So they're not taking a loss financially while they're in school. And then as soon as they are finished with that training, they're eligible for promotion into a patient care technician or multi-skilled technician position. So it's an amazing opportunity that our employees have available to them. And with the background that I have, I come from workforce. So I've seen a lot of different scholarship opportunities and grant opportunities available. It's unheard of for an organization to cover their employees' wages while they're in school. That is such a rare opportunity. And I just can't sing the praises of this program enough, because this is such a great thing for our employees to help them get upskilled and to help them promote and have more sustainable wages. So again, if you have any questions about this specific training program, please, my contact information is available at the end of the slide. Give me a call or shoot me an email. I'd love to chat with you further about it.
It is okay. So pharmacy technician, that's another position that we have available here at the hospital. There is a training program, which is why we wanted to mention this. It's a 90-day paid training program for our internal employees to become a pharmacy technician 1. So a lot of times when you see something like that, that you may want to be involved in, outside with CVS or with Walgreens, they're looking for experience. And a lot of people they don't have the experience yet. How do you get the experience when you don't have the experience? So we do have that pharmacy technician training program where you can come in and go through a 90-day paid training program so that you can be eligible for these positions. And then you can promote up as a pharmacy tech 1, 2, or 3, and moving into a lead role. You'll see that progression to learn more about how to assist our patients with their pharmacy needs. So patient registration is also a wonderful position that we have available here at both hospitals and our freestanding urgent cares as well. These are folks that have great customer service skills and are very organized. We do need some computer savviness on this particular position because you're typically working in 2 or 3 different types of computer systems and might need to toggle back and forth between the 2. That is some feedback that I get from time to time, is that's the hardest part for me to learn, is to toggle between the different systems. So these are great opportunities. We have full-time, part-time, and per diem opportunities. You'd be greeting the patients as they come in, registering them for various procedures, ensuring that their Medicaid, Medicare, billing, insurance, all of that is taken care of. So you're working with the patients, you're going to be one of their very first faces that you see when they come in to pre-register.
And one position that's not listed on this slide, but I'd love to chat more about it, is our outpatient service rep position. This position is very similar to our registration rep position. It is within our urgent care centers. So it's a predominantly urgent care center position, but basically the job responsibilities are the same. So you would be that first face that's greeting the patients as they're coming into our urgent care centers, and then just making sure that their billing information is accurate in the computer system, making sure that their contact information is accurate. It's taking calls, it's scheduling appointments when needed, and just coordinating the care for those patients so that they have a good experience coming into our urgent care center locations. Now, the pay for that position starting out is $18 an hour. And that is, again, only available in our urgent care center locations, but we do have 6 of those in Sarasota and Manatee County, and potentially a 7th opening up in South Sarasota County later in 2023 or early 2024. So we can talk about our benefit packages available for our employees. This is for full-time and part-time employees. We do have 3 different medical plans to select from, plus prescription coverage. We have 2 dental plans and we have vision through Aetna. Obviously prescription plans. We have great PTO packages available, retirement savings plan. We have a wonderful 403B because we are a nonprofit community hospital. We've got employee discount programs. We have free confidential counseling services. Also an employee referral bonus program that's been very widely used. So if you are connected to an employee at the hospital and you're applying for a position and you list that employee's name on your application, both you and that employee may get a referral bonus depending on the position that you're hired in for. So the referral bonuses are anywhere from, I think, about $1,500 up to $5,000 depending on the positions. So that's a great opportunity, a great incentive. And we do offer annual merit reviews and increases. So once a year, all of our staff receives an annual increase based on performance in their position. So that's a great feature as well.
Yes, and I just want to mention that part-time is 20 hours or more. So I know a lot of times people who want to work part-time aren't eligible for benefits, but as long as you work 20 hours or more, you are eligible for the same benefit package. All of the same benefits are available to you.
And I know we talked a little bit about the tuition reimbursement, but we do have, yeah, you're right. That's the next slide.
Oh,
nope.
Well, we just talked you fast. Here's what we wanted to say about the 20 hours or more. You are eligible for benefits and you're eligible the first of the month starting. So today is March 29th. If you were to start today, you'd be eligible for your benefit coverage as of April 1. So there's just not a lot of downtime that you have to wait if you're trying to transfer jobs and go without, we can get you the very first of the next month. We do want to talk about tuition reimbursement. And here we are, we got excited.
So our full-time and part-time employees are eligible for tuition reimbursement. This is a fantastic benefit, particularly for those employees who are getting started in nursing careers. So that career ladder that I showed, the patient safety attendant, climbing up to the CNA roles, the patient care technician and multi-skilled, and then on upwards. Tuition reimbursement is a huge part of that process, right? So all of our full-time and part-time employees are eligible after 90 days of employment. And for full-time employees, for undergrad or certifications or licenses, we cover $3,500 per calendar year. Part-time is $1,750 per calendar year. Excuse me. And for graduate programs, full-time employees are eligible for $5,000 per calendar year and part-time for $2,500. So we do prepay for any of the careers in nursing, and that benefit is a huge cost advantage. If you're going to a school like State College of Florida in the local area that uses state tuition rates, you can get just about the entirety of your educational background, your educational program covered through the tuition reimbursement.
Yeah, it's much cheaper than other schools in the area, and they have a 99% pass rate on their very first try for the NCLEX. So it's a great opportunity right here locally to receive the tuition reimbursement and then hopefully pass your NCLEX on the first try.
Yeah.
So this is what our screen looks like when you come to our career site. It's www.smh.com/career. And you'll see this screen that says join our team. So you can list any keyword down there to try to find the jobs that you're looking for. You can also list the location that you want to work in, try different things. If you're having a hard time finding the job that you want, please just reach out to Hannah or I. We have our individual emails listed at the end of this presentation.
It can be a little daunting trying to search our careers website for an open position that is a good fit for you, right? So if you do have questions and you wanted to chat with one of us about a position that might be a good fit for you, please feel free to contact us. It's also helpful for you to email your resume over so we can have a chance to review it just to see, okay, this is a position that she or he may meet the qualifications for. This would be a great position for them to go into. And again, because we have a kind of a pulse on what needs the hospital has open at that certain time, we'd be happy to talk through any questions that you have before you submit your application.
So here are just some helpful hints on the application process when you apply. Of course, we'd like for you to upload a resume. That's one of the first things that you're asked to do. Our managers really do like to see a resume. And I know sometimes people will say, oh, I don't have one. I've worked in the same job for a long time. We would really love for you to take advantage of the services that are available through Women's Resource Center to get that resume up to date. Thoroughly completing the application, checking the job descriptions for what is needed. So for instance, for that patient care technician role, you do either need to have a CNA license, an EMT license, or be in nursing school. So if, for instance, you're in a program right now to get your CNA license, you'll want to include that on your resume. Even if you're not finished, you can say, started the class in March of 2023, will be completing in April of 2023. And that way we will know how to move forward with you. So just please make sure that those things are on the resume. You can imagine that our managers are taking care of patients and running a unit and trying to help make sure things are staffed. So we want to make sure it's really easy for them and it's very clear when they're looking at your resume what you have to offer. There are screening questions that it's very quick. It's like 12 questions that just ask a few quick questions, but your application will go into an incomplete role or incomplete status if those screening questions aren't answered. And so we just ask that you please do that for us so that we can move forward. And then follow up with your recruiter afterwards. If you've done all that, you've really tried to make sure it looks great, you can give Hannah or I a call or an email. We'll review it and we'll see if we have questions or things that are that we just want to make sure we know first before we move forward.
So one really cool thing about our application process is that you do have the ability to monitor your own application to see what your status is, right? So as Corey mentioned, if you don't answer the screening questions, it's going to be an incomplete status. That application is never actually going to come to us to review. It's listed as incomplete and we don't even see it unless we do a search of your name. Now, that being said, it's also going to give you when action is taken on your application, it's going to give you those different updates on our website. So you log back in to see if your dashboard has changed. You can see once your application has been submitted to the hiring manager. You can see if an interview is being scheduled. You can see if the manager has reviewed your resume and decided to go a different way. All of that information is available on our careers website. You just log in to check the status of your application, and it's very easy for you to do on your own. But of course, if you have any questions about why your application process has changed and maybe you haven't been communicated with about it, you can always contact one of us and we'd be happy to answer any of those questions that you have. Once your application has been reviewed, typically the talent acquisition advisor that's working with that specific position with that unit, if there's anything that's required for the position, that person is going to reach out to you to let you know next steps. For example, some of the hiring managers that I work with require you to complete some assessments in a system called Relias. So we actually register you for Relias assessments and send those over to your email. We'll then communicate that with you to let you know, hey, just letting you know, you have these assessments that we'd like for you to take. This is part of our screening process. But again, once your application hits that submitted to hiring manager bin or review status, that manager or their assistant may call you directly to schedule an interview. So I would highly recommend that you have a voicemail box set up, because a lot of people have their contact information on their resume, but no voicemail box set up, or their voicemail box may be full, or maybe their phone number on their resume isn't up to date. So I would highly encourage you to kind of do those review things just for courtesy purposes, because a manager calling to schedule an interview with you may only call once. And if they're not able to leave a voicemail, then you might have missed out on that opportunity. So please make sure that your voicemail box has room to leave a message and that it's set up. That is one of the things that we find a lot of times is that happens where, voicemail box may not be set up or is full. And then the hiring manager isn't able to reach out and make that connection to schedule the interview. So at this time, we would like to turn it over to Lauren Pellico. She is one of our multi-skilled technicians at SMH. And like I mentioned earlier, she did get her start as a patient transporter. She's been with the hospital since 2018, and she recently finished the CNA training that's available at Suncoast Technical College that I talked about earlier. So Lauren, we're gonna hand it over to you to share.
Okay. Hi, my name is Lauren, and I started in 2018. Hard to believe it's been 5 years as a patient transporter, coming in, not knowing not much really about the hospital. I do agree with what Hannah said and with Corey. When you're a patient transporter, you are in many different areas of the hospital, so many nooks and crannies. You think it's just nurses and doctors, who run the hospital, but there are so many different areas. And when you are in those areas, you are meeting different people and you're learning about what each department does. And again, that definitely opens your eyes to where do I want to go next? Where's my interest lie? After being a patient transporter, I went into work in the OR. And prior to that, I became a widow, and I had to think about what am I going to do for me now, my future. So I started into the OR, and working in the OR, I was then asked to be a part of the electrophysiology anesthesia turnaround, which is part of the OR, but it's more based on the heart. And I did well in that area. Then I was looked at to do a remote anesthesia support, working with the nurses. The reason why they chose me is because I had the experience of being a patient transporter, and I was familiar with where the different departments are. If you were to ask a nurse, how do I get from point A to point B? They're going to look at you and say, I only know where my car is parked and what floor I work on. So I'm very happy to share with anybody. I can help you to get from point A to point B. When I was working in the anesthesia department, I saw that a job had come up in the EP cath lab for an MST position. I approached the manager and I told her that I was very interested in that position. I had already working within that department, but not really directly with my management. They know the work that I do, the hard work that I do. And I said, I do not have a CNA. I'm not in nursing. I said, but my goal is to get my CNA. My manager said, I will sponsor you in the program and you will go to school and get your CNA. And I could not have been more grateful to everyone who has helped me to pursue my goal of getting a CNA. I did the program for 6 weeks. I didn't think I could do it after so many years of being out of school, but it still works. And I just completed my CNA testing, the written skills, the clinical skills, and I passed. And and I'm proud of myself. It's something that I did on my own. I feel that this is going to open the door to so many other opportunities that are here in the hospital. And this is just the beginning. I just can't wait to see what else is going to happen for me. And as you can see in the pictures, that's my beautiful family who are very supportive of me, and they could not have been any more happier. So that's my story.
It's a good story.
It's a great
Thank you.
story.
That's amazing. Thank you so much for sharing, Lauren. I think, seeing your journey is incredible, and it really shows the growth that is available at SMH, and also the investment that they make in their employees and wanting to see them succeed. So that's fantastic. Hannah, Corey, anything else before we move to Q&A?
Well, we want to make sure we share our contact information. So
Yes.
hold on just a second. What did I do? I don't know. Here we go. Okay.
So there's our contact information. Hannah primarily helps at the main campus and I primarily help at the Venice campus, but honestly, both of us are just happy to do whatever we can for each of you.
Yeah.
So you just let us know how we can help. There may be a position that we didn't say one thing about that you see on our website. We may not know too much about it, but we'll find out for you.
Yep.
So don't you worry. We thank you so much for your time today. We thank you for your interest in Sarasota Memorial Hospital. We both love working here. It's been a blessing to each of us. And so we wanted to share that with all of you. And like we said, we're always happy to do whatever we can for you.
And it also just erase the things that you've thought in the past about working in a hospital, right? Like you do not have to be a doctor or a nurse to work here. I do not have a clinical background at all. Neither does Corey, right? So we both have an educational background, ironically enough, right? And we're in human resources at SMH, right? There are so many opportunities here for people. And really, we just would love to be able to engage with you and help you on your career journey. If this is a good place for you, we would love to help be part of your journey in getting here.
That's fantastic. Thank you both for sharing. And just for everyone on the call, if you didn't have a chance to grab the contact information, it will be in the recap email. So don't worry. You'll receive a copy of this presentation as well as their contact info. There it is. So if you need some more time to take it down, we can leave it up for you.
Brent, I think Lauren wanted to add one thing too as well.
Yes, please.
There's a quote that I've always said, and it's learn what you can when you can, and one day you'll be grateful that you did. And I just feel again that no matter where you are, just learn what you can, because one day whatever you're learning is going to benefit you and for your future.
Thank you, Lauren.
You're welcome.
All right, everyone. So with that being said, if you do have questions, there's still time to put your question in the Q&A box at the bottom of the screen. And we have a couple in here already. So the first one is, do you require background checks for the entry-level positions? And if so, are you automatically flagging for having any type of background, or what's necessarily maybe looked at on the background check?
So we do require a background check for all of our positions. Yes. Now, Corey mentioned in the application process that there are screening questions that you have to complete. So one of the screening questions asks if you have had any previous charges, whether convicted or not, any previous charges, and to detail what those are. So yes, we do background check, but if you have been forthcoming about your previous background, if you've had a conviction in the past or a charge in the past, and you've detailed that out on your screening questions, then we review that. For most of our open positions, if there's anything in the past, within the past 5 years or so, if it's further back than that, then depending on what the charge is, we can still move forward with the offer. Again, right, transparency and honesty is most important in this instance. We understand that everybody has a history and everyone makes mistakes, right? And so we don't want to use those as a penalty, but we do ask that you be transparent about those in the application process as well.
Beautiful, thank you. So another question, how do I apply for patient transporter? Is a resume needed, and do I need to mention I was at this seminar?
So you can just apply online, go to that www.smh.com/careers. You'll see the screen that says join our team, and you'll want to type in the words patient transporter, and you'll see all of the different openings that we have available. We absolutely would love for you to have a resume. I'm not saying that it's absolutely required. If you want that job today, and you don't have a resume today, I would say go ahead and apply for it. We'll forward your application on. But if you can put together a resume in the next 24 hours, that would be great too. There's so many templates on right now on Google that you could do it very easily. So What was the question? Do you need to apply? Do you need a resume? And then there was a third one.
Oh, you do not need to list that you are part of
Oh.
this webinar, but it couldn't hurt either. I don't know where you would list it on the, like maybe in the, how did you hear about
How'd
this
you hear about
position? You could list that you attended this webinar. But again, so it really just depends. I know you recruit for the patient transporter positions in Venice,
Mhm.
correct?
Yes.
So I do not recruit for them in Sarasota, but if you reached out to me and let me know that you applied, I could pass that information along to my colleague who does hire for those positions.
Beautiful. And I should add too, if you do need help with your resume, contact the WRC, our career coaching program. We can help you put together a resume. Absolutely. Another question here for the sterile processing assistant. Do you need experience for that role?
In Venice, they are requiring experience. It's a much smaller campus. And so
Mhm.
everybody has a very vital role in each step. So they do want the folks to have experience there. But in Sarasota, you do not need to have experience. And there is a real shortage right now of that. If that's something that sounds interesting to you, they're doing a lot of different things right now to try to retention bonuses
Yeah.
and different things to try to make sure that you stay happy and stay in your role. So that's something that I would really strongly encourage you to look into if that's something that piqued your interest during the webinar today.
That's great. Are there part-time shifts available for patient transporter?
I believe the patient transporter positions in Sarasota are only being hired currently as per diem. So that's that
Okay.
PRN. So yes, part-time is available. That would be more of a part-time status than full-time. But you do have the opportunity, even in our per diem positions, to pick up additional shifts and work up to full-time hours. But it does start out as per diem.
And in Venice, we have one part-time opening available right now. It's 24 hours a week, 3 8-hour shifts.
Beautiful. Another question, and maybe something we didn't talk well, a little bit, we spoke about some of these roles, but someone with a customer service experience, can they apply for sort of a medical office, a front desk role? I know we talked about patient registration. What maybe are some other roles with customer service experience?
That outpatient service rep position in our urgent care centers, that requires 2 years of customer service. And it's a pretty decent position in terms of responsibility, right? And increases. The urgent care center managers are always looking to help promote their people. So you may start out as a per diem outpatient service rep with the 2 years of customer service, but then you can quickly increase to part-time, full-time, or even they have additional opportunities for growth over in the urgent care centers.
Mhm. And in our first physicians group, doctor's offices, they have a patient relations rep. That requires a lot of customer service. I know there's quite a few openings for that right now. We just had a job fair this morning to try to help facilitate some of those openings. I have a retail attendant position, which is customer service. That's part-time in the cafe. That's in Venice.
I think we have some in Sarasota as well.
Mhm. Patient transport really is 100% customer service.
Yeah, it is.
It's patient care, but what we need is somebody who's kind and loving and will take good care of our patients with customer service skills.
Mhm.
Excellent. This is a very specific question, so I'm not sure if you'll have the answer, but regarding a position, but do you have positions for screening newborns for hearing?
I know that that's part of our process, but I think that that is encapsulated within the labor and delivery and NICU units and not a specific person that's hired for that.
Right, right. That would make
That's
sense.
what I
So
think.
maybe look for a role within that department. Wonderful. And then
Yes.
someone was asking, what was the name of the job position for the front desk? Was that patient registration?
So we have patient registration,
Outpatient service rep.
patient relations rep.
Mhm.
I know at the main campus, I don't know if they have an opening right now, but they have a telephone representative.
Mhm.
Sometimes that one comes up.
I haven't seen that one posted recently.
Yeah.
Okay, great. Another question here is The viewer is a certified medical coder, but is looking for more people-oriented position. Is there anything that you could recommend?
I would think the patient registration rep would be
Yeah.
great with the background because that's 100% people, but we need
Right.
somebody who has the ability to do all that computer work too.
Right, right.
Same with probably that,
Outpatient service rep position as well in
Yeah.
our urgent care centers.
because you're right, most of our coding is we have several remote positions right now for coding. So it
Yeah.
definitely is, if you're a people person, you might get a little lonely in that one.
Absolutely. Do you need a GED to answer phones? So I'm assuming this would be some sort of entry level.
So like, again, those patient registration, the outpatient service rep, those type of positions that are kind of handling those phone calls as they come in, patient relations rep too, you would need a high school diploma or GED for those positions. Yes.
Mhm.
Okay, great.
Yeah. But you know what? You could get your foot in the door someplace else and
Yeah.
help guide you into that process. So you'll already be here.
Right.
You'll already be part of the team. You'll already have the benefits, and then we'll guide you on that. We've had lots and lots and lots of people who've come here in a different role, discouraged about not wanting to go to school. And then they get empowered when they get here because they see all the places that they can go. So I
Yeah.
do encourage you, get your foot in the door someplace else and then make it a priority for you to get that GED.
Yeah.
And
You can do it.
most of the units will hire you on, right? So those entry level positions, a lot of them have a requirement for you to stay in that position for a full year, but the patient safety attendant will release you after 6 months. So again, that's another way. Like if you are interested in coming on board and maybe doing something more, like patient registration, but you start as a patient safety attendant because they only require 6 months. You work on getting your GED in that 6-month time period, and then you're eligible for transfer into patient registration at that time.
Yeah. Perfect. Corey, Hannah, to your knowledge, do you know if there are any openings for phlebotomists?
Yes.
Great.
Yes, we definitely do. I know I have a per diem position available in pre-admission testing right
And I
now.
believe there are several positions posted on the main campus in Sarasota.
Fantastic. Wonderful. Well, we've reached the end of our question and answer session. So thank you, Corey and Hannah, for fielding those questions for all of our viewers here today. And I just want to thank everyone for joining this webinar today. I think it was really, really fantastic just to hear more about SMH and just all the opportunities that one has, whether on the clinical or non-clinical side, and how much SMH is really invested in their employees is really, really great to hear and see that that's available in our community. So I want to thank our presenters. I want to thank everyone who tuned in today. As a quick reminder, the survey will pop up as soon as I end this webinar on your screen. If you could just take a few extra minutes and fill that out, we would greatly appreciate it. So with that being said, I hope everyone has a great rest of your day.
Thank you.
Yeah, thanks so much, Brent, for having us. We really appreciate it.
Yes, thank you so much for joining.
Absolutely. Thank you.
All right, bye everyone.
Bye-bye.
Bye.